My name's Jenna Hills. I'm a physiotherapist at the Royal Hospital for Children in Glasgow. Um, I work predominantly in the paediatric intensive care unit, looking after children who are critically unwell, helping them to clear their chest and to get them up and moving after a critical illness. So we cover the whole of Scotland within the Children's Hospital, and that's can be really hard from a geographical perspective. A lot of the time the patients have to travel to the hospital to see a professional, and actually now that patients can't travel, there's a whole load of virtual clinics that have been set up, and I think that hopefully will continue, not in every aspect, because there are situations where you need to see a patient face to face, but where it is checkups and where it's information gathering, actually those can be done over virtual calls, etc., and confidential clinics. And so I think that will hopefully make a bit of a difference, and that will help, reduce traveling times for families, having to travel in from far distances. So when it started, I was on maternity leave. I had some guilt because I knew my team were having to prepare and were dealing with the stress of everything building for the first couple of weeks. But I also had the awareness that it probably would be good for me to wait and go back when I was supposed to, because then I would be fresh and energised and help hopefully support the team at the right time. So I started back on the 8th of April. We've done a lot of preparing to help the adult side of things. So one of the things that's been helping patients is having them lie on their stomachs. And in order to turn somebody, an adult, on a ventilator onto their stomach, it takes a team of 7 people. So that's really labour intensive. So all the physios in the paediatric hospital have been trained up to make sure we could do it as slick and as organised as possible, so that we could then go in and help the adults if that was required. On the Wednesday, I took part in a it's called Pruning a patient. I took part in a pruning team. The Thursday was my second attempt at it, and then the following Wednesday I was teaching the PICU staff how to do it. So it was literally see one, do one, teach one. So it was that quick to sort of get everybody going, and we were teaching all the PICU staff so that if we ended up taking adult patients, that they would know how to do it, or if they had to go over and help adults as well.